What are some of the kinds of things people need to be on the lookout for, especially because people are going to be hands-on when they actually clean up or maybe wade through the water trying to get to some of their possessions?
Yeah, big time problems, Keenan. Obviously, when you have water that's to the level that it is now, you can have chemicals that are there. You can have also infectious agents. And the other thing is that you could have rodents and other even snakes that are in the area. So please don't touch the water. And if you do touch the water, wash with soap and water, because you can really have problems with diarrheal infections. If you have any open wounds, that can get infected. So big time problems with touching the water and being in contact with them. So I'd recommend anybody who's been in contact really to wash their hands and clean themselves thoroughly with soap and water.
And I would assume you would need to do the same thing to any of the possessions that you have that may have been flooded. You need to wash those off or wipe those down with some sort of sanitizer as well?
Absolutely. And here's the thing, leave it to the professionals to really go out and clean it. When you clean and you start to get rid of some of the water and the water damage, you can also worry about mold. And mold is a big problem, because once you start cleaning it, you can release this mold, and especially immunocompromised kids, pregnant women, this mold can really affect you, and the symptoms could be respiratory, and you could really have health ailments that can get worse. So I would recommend that get professionals, and when the cleaning happens, stay away from the area if you can, to avoid having all the symptoms of mold that can be released when you have the cleaning. But bottom line is, stay away from the water. Lots of damage that you may not even think about that could happen to your body.
All right, Dr. Parthanandi, the headache here for the folks in Dearborn Heights and Allen Park and in Taylor will just go on and on. This is going to be a long-term disaster and a very slow road back. Dr. Nandi, thank you so much for joining us this morning.